If you have been interested in learning more about therapy, it can feel like the hardest part is just getting started.
So today we're talking about what you need to know to make the whole process a little less overwhelming and the right questions to ask when meeting a therapist for the first time. Joining us now, we have family and clinical psychologist Dr. Jen Hartstein with us. Dr. Jen, thanks so much for being with us this Friday. For a lot of people who are curious about what therapy is or what it could look like for them, what is the first step that someone should take if they're looking to get started?
It's a great question. And truth be told, the first step is deciding that it's something you might need, right? So that's kind of the hardest part, is going, hey, maybe this is something I need to do, and make that commitment to yourself. We frequently go, yeah, this is something to do, and it gets overwhelming, or we don't know how to start, so we just don't. And really take some time with yourself to decide, what do I want to go to therapy for? We all could benefit from therapy. Let's be honest, a place to just talk about ourselves, like what's not to like about that. But some of us have a specific thing we want to address. So think about that when you go into kind of find the right therapist for you.
Dr. Hartstein, how can people find the correct mental health professional? I know it's a little bit of, try it out, test it out, and walk through the difference between psychologists, psychiatrists, and counselors.
Or even like a licensed social care worker.
Yeah.
Right. It's like alphabet soup a little bit, I think, when we're stopping to think about it. So one of the big differences, a psychologist is a person who's gone to get a degree for 5 years. They usually have a PhD or a PsyD after their name. So they're a doctorate of philosophy or a doctorate of psychology. A psychiatrist is an MD, so they can prescribe medications. A licensed social worker would be an LMSW, an LCSW. You can have a licensed mental health counselor. So it's alphabet soup. And the fact is, all of us at the end of the day, our trainings are all different, but we can all provide really solid psychotherapy for what you need. So as you're doing your research, you might kind of be like, oh, this person really resonates for me. Let me see what they're like.
Well, speaking of that, does one training background help if you have a specific issue? So if you're someone who suffers from anxiety, would you go to a different type of specialist versus someone who suffers from depression?
So all of us can get very specialized training. So let's say I really want to be someone who specializes in teenagers. I'm going to probably take a course of study that puts me in that space, right? Or I want to learn cognitive behavior therapy. So I'm going to get specific training in that area. So if I sit with myself and go, hey, I'm having anxiety moments, I'm really feeling overwhelmed, I think I need somebody to give me those skills and strategies, I'm going to find that person. And that training can go across all degrees. So it's not necessarily only the degree, but some of us prefer to see a psychologist versus a social worker. It's a little bit of personal preference.
Let's say you have chosen a therapist, a psychiatrist, and you're in that first consultation. What are some key questions you need to be asking so you can figure out if it is a good fit?
Right. And I think one thing most of us don't think about is you can often ask a psychologist, psychiatrist, therapist for a 10 or 15-minute phone call to see how you feel about it even before you show up. But some things to ask, right? How long have you been in practice? What's your rate? And in that, you might want to know, do they take insurance? Will they work at a sliding fee with you if you can't afford their fee, but they feel like a good fit? Dig into what their areas of expertise are. A lot of times in an advertisement, people throw a lot of information out there, but you really want to know what that is. And then the last thing you want to ask is, like, what's a session like? What can I expect when I walk in? Are you an interactive therapist? Are you one that sits back a little more, so that you don't go in totally blind? And if you can get that consultation call, you can get a sense of personality, and if that feels like someone you want to kind of move forward with in a more serious way.
And I guess final question, Dr. Jen, are there any sort of red flags that people should watch out for during that initial consultation?
Well, I think that if that therapist is really talking more about themselves than talking about you, that's a huge red flag. If they refuse to answer your questions, that might not be someone you want to work with, right? If you can't feel like you can trust that person, even in that initial 15, 20-minute call, you might want to go find somebody else.
Very good advice. Family and clinical psychologist Dr. Jennifer Hartstein, thank you so much. Have a great weekend.
And you are watching NBC News Daily.